Okay. Welcome everyone to Fairfax Cryobank's webinar for today. The topic today is donor sperm in office, IUI, and home inseminations. We are going to be recording this webinar, and I will be on camera, as will Kate Wisda, our nurse practitioner. I know that if you're accessing on a mobile device, you may not be able to see the camera, the talking heads during the presentation, but those will be recorded as part of the webinar, and when we send it out to everybody who's registered, you will receive the link. The video will include the talking heads. The reason I'm mentioning this is that Kate is going to do a little bit of a demonstration using some props to show everyone how to do the home insemination and some of the equipment that's used for the in-office insemination. So as we get started, just a note again that this is being recorded, and we are going to be working to answer your questions at the end through a Q&A session. You can submit questions throughout the webinar in the little question box on the side. Please do submit your questions. We're going to do our very best to get to all of them. Any questions that we're not able to answer during the webinar, Kate and I will work on, and Christy will work on a blog post that answers as many questions as we can. Okay. So today's speakers are going to be Kate Wisda, our nurse practitioner. She's a women's health nurse practitioner for Pacific Reproductive Services at our Pasadena location. I am Michelle Ottey. I am the lab director and the director of operations for Fairfax Cryobank. And I will be presenting a brief chat about donor sperm, and then that'll lead into the insemination process. We will have Christy Burke, our Assistant Director of Client Services, on the Q&A session to help answer any of your customer service related questions. And Morgan Barker, our Senior Marketing Manager, will be moderating the Q&A section for us. So I always like to start the webinar by just presenting the goals for the webinar, and just so that we're all on the same page. The first part of the webinar, like I said, is going to be an overview of donor sperm options. The second part will be a review of home intracervical inseminations, or ICIs. The third part will be a review of an in-office IUI, or intrauterine insemination, and then we'll close things out with a Q&A session. Bottom line, we're doing this to help you along your journey to parenthood. So I'd just like to get started by talking a little bit about terminology. You may hear Kate or I refer to ART, meaning artificial reproductive technology or assisted reproductive technology. ICI is the shorthand acronym for intracervical insemination, where the semen is placed at the cervix. IUI is the acronym for intrauterine insemination, where the semen is actually inserted through the cervix into the uterus. We'll talk about home insemination, and when we do, we're referring to an ICI, because when you're doing an insemination at home, you're placing the sample onto the cervix. It's something that you can do in the comfort of your own home in order to attempt to achieve pregnancy. When you're working with Fairfax Cryobank, you're actually benefiting from having 3 quality donor brands. We offer Pacific Reproductive Service donors, Cryogenic Laboratories Incorporated donors, and Fairfax Cryobank donors. All of them have the same great quality. There are some differences in what's available. Fairfax Cryobank acquired CLI and PRS over the years, and we are working to maintain the high standards of those brands, as well as incorporating the processes into the Fairfax Cryobank brand. So there are a lot of donors to choose from. When you are at the step to purchase your donor sperm, you have to make a choice about the specimen prep type that you'd like to purchase. And so I thought it would be helpful to just do a quick review of the specimen types. You can purchase an ICI, or intracervical insemination preparation. These are standard samples that are unwashed. What that means is that the semen specimen is produced. We do a semen evaluation to ensure that the quality is good. We evaluate all the different semen parameters, such as count, motility, morphology, and progression, all of those different parameters. And we add a freeze media that helps to protect the sperm through that freeze thaw process, because as you can imagine, that's not easy for the little cells to go through. But our goal is always to put at least 10 million total motile cells into the vial, so that that's what you have upon the post thaw. The ICI samples can be used for an intracervical or ICI insemination at home. They can also be used by a clinic for an IUI if the clinic is able to wash the sample, which means that they're going to wash that seminal fluid out of the sample. And the reason that's important is that you don't want to place a full semen sample with seminal fluid into the uterus, because some of the proteins and hormones that are present naturally in semen can cause cramping. So an ICI prep, again, can be used for the intracervical insemination. It can be used for an IUI if the clinic will wash. And of course, it can be used for any ART procedure, whether it be IVF or ICSI. We also sell intrauterine or IUI preps. These are samples where the semen is produced. We actually do the semen evaluation for all those parameters I mentioned. We then wash the semen, the seminal fluid away from the sperm to remove all of that seminal fluid with the proteins and the hormones and everything. And we resuspend it in a wash media and a freeze media, again, to help protect the sperm. And then it is frozen. And again, we're aiming for at least 10 million total motile cells at the post thaw. Not all of the cells that are frozen are going to survive. Only about 50% will generally, anywhere between 20 and 50% will generally survive that freeze thaw process. And so obviously we're putting far more cells into the sample than that 10 million. Like I said, we're aiming for 10 million total motile cells. An IUI prep can be used directly for an IUI. Your clinic does not have to rewash it. You can use it for an at-home ICI preparation. And the benefit here is if your clinic doesn't wash or you don't, or doesn't offer that process, you can purchase the IUI prep directly. And then lastly, we offer ART preps, which are an IUI ART or an ICI ART. If it's an ICI ART, the seminal fluid hasn't been removed. If it's an IUI ART, it has been removed. Now, those have fewer total motile cells in the post-thaw vials. And we've created these as a lower cost option for anybody that knows that they're going to proceed with an ART procedure, such as IVF or ICSI, because you need fewer cells to achieve fertilization in that lab environment. Now, if, for example, the donor that you really like and would like to choose only has ART preps available, you can use those for other things. 2 ICI preps can be combined. 2 ICI ART preps can be combined for an ICI. 2 IUI ART prep vials can be combined for an IUI. So you have a lot of options. Just remember, IUIs are washed, ICIs are not washed. And then lastly, just a note, Fairfax currently has over 450 great donors to choose from. Once you choose your donor, you're going to purchase your vials. And we do recommend, if you're interested in having more than one child, that you consider purchasing several vials, and you can store with us. You can always sell the vials back if you end up not using them or not needing them. If there are questions about that, Christy will be happy to answer those at the end. And our client services staff is always available to help you navigate the process of choosing a donor, ordering your donor, through the whole thing. Okay. So to get us moving in the direction of inseminations, the first question that we often get is, do I actually need to work with a medical provider? And the short answer is yes. Fairfax Cryobank always recommends that a person trying to achieve pregnancy is going to work with a medical provider. And that can be a physician, a gynecologist, a midwife, anyone that you're working with. The reason we recommend this is because it's always good to have an assessment of your health, your lifestyle, and have a medical provider give you recommendations to prime your body for pregnancy, to get you ready. They may recommend fertility testing depending on your age or your medical history. They may recommend prenatal vitamins. They may recommend some lifestyle changes. it's always best to ensure your body's readiness for pregnancy before you invest money and time into either the home insemination process or the in-office IUI insemination process. And this is a great transition point where I'm going to turn things over to Kate. As I said, Kate Wisda is our nurse practitioner at our Pasadena clinic. She is fantastic, great bedside manner, lots of experience and good knowledge. She's going to talk you through the home InSem process, which we've done before in a previous webinar, and the in-office insemination as well. So Kate, I'm going to change presenters and turn things over to you.
Hello, everyone. My name is Kate. I'm a women's health nurse practitioner, and I'm here to talk to you about inseminations. We recently did a webinar on ICI, so we are going to still talk about ICI today. We're going to take a moment to talk about checking for fertility ovulation predictor kits, and we're going to spend a little more time on intrauterine insemination. Okay, and please put questions in the box as we go along, and hopefully we'll have some time at the end to answer those questions. Okay. So is home insemination right for you? Yes, if you are free of fertility issues, if you're comfortable with performing the procedure in your home, and you have discussed family building with a medical provider. So a lot of people ask about this medical provider portion. If you call your gynecologist and ask for a preconception exam, they can do that for you. That could include a pap smear, it could just include lab draws, but they'll determine whether or not you're healthy enough to get pregnant. You can also call your primary care if you feel more comfortable with primary care. Okay, our home delivery. So we do have some required forms prior to ordering, and you can find those online. We also have a client services department that can help walk you through this process. Our client services department is fantastic. They are specialists, and they'll be able to answer a lot of questions that you have, not only about the process, but about the donors as well. You will receive a box with a shipping tank that contains your sperm sample, paperwork, and a needleless syringe. We'll talk about that in detail later on. Why try home insemination? Often couples are told to try at home for several months when they want to start their family. Home inseminations allow for individuals and couples without a sperm providing partner to try at home before moving to in-office procedures. Getting started. So we're going to take a moment to talk about fertility and to talk about ovulation predictor kits. So the person being inseminated must track their menstrual cycle. You can get a period tracker app. Really anything out there is fine. We're going to talk about how to understand it in terms of insemination. And you also want to get an ovulation predictor kit. I have a sample here. It looks just like a urine pregnancy test. You pee on the stick, and then hopefully there will be two lines that pop up right here. You have a control line and then your line, which will pop up when you have an LH surge. You can get them at any drugstore, you can get them online. And then over to the right, we have a picture. So it explains the ovulation predictor kit. For those who don't know, it explains that you're going to have an LH surge. Your LH surge is when a hormone called the luteinizing hormone spikes. It spikes really, really high. It's at a low level, spikes really, really high here on day 11. And then we know that 24 hours later, you're going to ovulate. I like this slide a lot because it says that your two most fertile days are these 2 days. When you're inseminating, you don't have 2 fertile days. You have 1 fertile day. If you're having heterosexual sex with fresh sperm, then that sperm can live in the body for up to 5 days. So potentially, if you're not inseminating, if you're having heterosex, on cycle day 8, you could have sperm that lives inside your body for up to 5 days. You could still get pregnant on day 12 when you're fertile. When we're inseminating, we know that our sperm is going to last up to 24 hours. So we want you to make sure that you're only inseminating on your ovulation day, which would be the day after your LH surge. The LH surge will give you that positive OPK test. I would also recommend that you opt for OPK test that has the 2 lines as opposed to the digital happy face. The 2 lines are more accurate and more fine-tuned to that exact fertile day. The happy face is going to tell you that you're fertile for several days before you actually are. Fertility window. You are most fertile for a 12 to 24-hour window, typically between the days of 11 to 15 of the menstrual cycle. So we know that cycles last typically 28 to 31 days. When you're fertile is roughly day 14. I have plenty of patients who are fertile on day 19 and those who are fertile on day 12. So it depends on you. Your period tracker app and your ovulation predictor kit will help you find which day is typically your fertile day. Most women will have one day that's their typical day, and you could vary maybe by 1 day, maybe 2 days, depending on your cycle. This is unique to everyone. Best to monitor your cycle for several months to establish your regularity. Your medical provider can answer questions about this. So I can't stress this enough. Ovulation predictor kits can be difficult for maybe half of our patients, meaning that the LH surge comes irregularly, or maybe it takes a few days. It's kind of tricky. So I would recommend taking a couple months, if you have a couple months, to understand your cycle, to understand when you ovulate and what that ovulation predictor kit is going to look like for you. Some women will have 6 days of a very light line, and then on the 7th day, they'll have a very dark line. Some women, they'll have no line at all. They'll wake up the next morning and have a very dark line. So it completely depends on the person, all right? What do I need to do? What do I need to do a home insemination? A comfortable space where you feel safe, a needleless syringe, the sperm sample, instructions, some insulated gloves, and eye protection. We will talk about all of these in detail as we go along. Prepare the space and yourself. It's important to have a comfortable, safe space. Ideally, you'll be reclining on your back with pelvis tilted for up to 2 hours. I recommend that you have something that brings you happiness, whether it's music, candles, maybe you like to breathe mindfully, maybe you like to meditate. That's the frame of mind that you want to be in when you're inseminating. Okay, intracervical insemination. Gather everything you need and place on a solid surface. Open the needleless syringe, leaving it in the wrapper. So this is our syringe, and it comes in a sterile wrapper. This is technically a clean procedure, not a sterile procedure, but your syringe will come in a sterile wrapper. The sperm vial thawed per the instruction from the cryobank. Remove the tank lid. You'll see a small puff of vapor. Wearing gloves, insulated gloves, carefully remove the cane holding the vial. So you can see this picture right here. I've got a cane as well, and there's a vial inside. So you'll remove the vial from the cane, verifying the donor number. The donor number here is 1234, so I've checked that with my paperwork. Wrap the vial in a cloth or paper towel to dry off any condensation. Leave at room temperature for 15 to 20 minutes. I apologize for that. The person doing the insemination, self or partner, will wash their hands thoroughly. The person being inseminated will lay on their back with their hips elevated. Use a cushion to support the back. So the cushion doesn't necessarily go under your back as much as your buttocks. You want your pelvis tilted upward because at the end of the vaginal canal is your cervix. The cervix is the muscle that leads into the uterus. You want that sperm to be sitting on the cervix. Pick up and gently mix the sperm vial. Allow the volume to settle to the bottom. So let me show you. This is your vial, and it's going to have the frozen sperm in it that you left on the counter for 15 to 20 minutes so that it can defrost. When you mix the sperm vial, you're not going to shake it. You're going to invert it very carefully. You've got 6 million, 10 million sperm in there, and you want to keep them safe, right? So shaking will damage them, but inverting it gently will protect it. Open the syringe, pull the plunger up to break the seal, and push it back in its original position. So you're going to open this syringe, take the syringe out, and there's a little trick that nurses know is these plungers get stuck. You don't want it getting stuck while you're pulling up the sperm. So just kind of loosen it, mess with it a little bit, make sure it's not stuck, and you should be fine. You or your partner will carefully open the sperm vial by unscrewing the cap. So this is your vial, and it has a little cap on top. Please know that the amount of sperm that you get will be very small. That's okay. There are millions of sperm in that tiny little sample. Slowly and carefully draw up the sample into the needleless syringe. So you're just going to pull back on that plunger until you get all of the sperm. This isn't like injecting blood, so you don't really have to worry too much about air getting in there. That's fine if there's a little bubble of air. You're going to place the syringe into the vagina as far as it will go, with the tip close to but not touching the cervix. So hopefully you can see my cursor here. This is the vaginal canal. You'll insert the syringe into the vaginal canal, hopefully getting close to the cervix, and then you'll depress the plunger so that the sperm stays around here, the cervix. This is the cervix. It's the muscle before the uterus. All right. Remove the syringe and relax. The recommendation is about 2 hours laying down. Highly recommend switching from your abdomen to your back every 20 minutes. As you switch that position, the sperm will wash over the cervix each and every time, reintroducing the sperm to the cervix. And you can do that on and off for about 2 hours, whatever's comfortable for you. Some individuals like to use a soft cup placed on the cervix after the sperm is expelled. Not necessary, but some find it helpful. So a soft cup is, you can see this picture right here, the woman who has her hand holding the soft cup. If you go on Amazon, you can just Google soft cup, and there should be some examples that come up. This bottom picture down here, it looks a lot like a cervical cap or a diaphragm. That's also something you can use. If you have a Diva cup already, you're welcome to use that. Just please read the instructions to know how long you can keep it in for. Remaining reclined allows the sperm to swim through the cervix and into the uterus up to the egg. Some individuals choose to do multiple inseminations during the fertile window in one cycle. Speak to your medical provider about this option if you have questions. What is the cost of home insemination? The cost of the donor sperm, shipping and handling, and Fairfax Cryobank will provide written instructions for thawing the sperm sample, which we talked about, putting it on the counter for 15 to 20 minutes, and for the IUI along with the needleless syringe. So this syringe will actually come with it, and it'll come in its sterile container. Success rates. You have no fertility issues or concerns, and you're under the age of 35, it is up to 10% success rate per cycle. It can take several insemination attempts to achieve pregnancy. If you're not pregnant after several home attempts, it's best to speak with your medical professional about having a fertility assessment. Again, I would recommend doing this before you even begin. I think it's a good idea to know what's going on in your body and to make sure that you're healthy enough to get pregnant. If you have any conditions like PCOS or maybe hypothyroid, it's really good to make sure that those are controlled before you start trying to get pregnant. Okay, next we're going to talk about intrauterine insemination. So this is very similar to an ICI. Normally the ICI syringe stops right here, and you wash the sperm over the cervix. With the intrauterine insemination, you're actually going to use a catheter that goes all the way into the uterus, and you deposit the sperm into the uterus. So the IUI will bypass the vaginal canal where you would have done the ICI and cervix to enter directly into the uterus. The sperm then only has to swim into the fallopian tubes to get to that mature egg. Why try intrauterine insemination? It's a good idea if you're not comfortable with the ICI procedure. There are higher success rates. We will talk about success rates as we go on. If you have something like reduced fertility, advanced age, advanced maternal age is actually over the age of 35. Ovulation predictor kits, like I said earlier, not all the ovulation predictor kits are made equal. I would recommend getting the ones with the 2 lines. It's a chemical reaction on this, I don't know, I refer to it as a litmus paper that will actually occur right here on your screen. I would recommend getting that as opposed to the digital. Even then, ovulation predictor kits don't work for everyone. With intrauterine insemination, you're going to have medical oversight. So if you have a history of an early miscarriage or polycystic ovarian syndrome, or you have hypothyroidism, low fertility, difficulty predicting ovulation, or even if you just have irregular cycles that are all over the place, not meaning 1 to 2 day difference with ovulation or 1 to 2 day difference in length, but irregular, where you miss months at a time, or you have a 6-day difference in the length of one period from month to month. Additionally, ultrasounds to watch the follicle growth, medications to ensure ovulation, potentially prevent early pregnancy loss, etc. So there's a lot of other things that we do with intrauterine insemination where we can use an ultrasound to check the follicle and see that the follicle is growing appropriately. This will increase your success rates. So what you will need. We spoke earlier about speaking with your doctor and being cleared. Your labs. A preconception panel consists of HIV, hepatitis, syphilis, gonorrhea, and chlamydia. Fertility assessment and labs may be needed for you depending on what your medical history is. We usually like to see a normal pap, normal thyroid, and we want to make sure that you don't have any major vitamin deficiencies. Fairfax will actually ship directly to your clinic. So the lab will prep the vial for you. You don't have to worry about Fairfax shipping to your home. They'll ship directly to your clinic. Your clinic will handle that for you. There are some optional things that you need. Ovulation predictor kits are what most people use. Some people will use ultrasounds instead if the ovulation predictor kits don't work. Some patients prefer to use fertility medications, which can, again, boost your chances as well as increase your number of follicles. So there's 2 main tools used for an intrauterine insemination. There's the speculum and the catheter. The speculum is what's used during a pap smear. It goes into the vaginal canal and stops right at the cervix. So this way we're able to insert the catheter directly into the cervix. The cervix has an existing hole that is open when you're menstruating. It's also open when you're ovulating. So we're not cutting any tissue. We don't expect any active bleeding. Most patients experience an odd feeling or a feeling of discomfort, but pain is pretty rare. So we insert the catheter. This will have sperm in the syringe at the end. It's just like the one you used for the ICI. We insert it, depress the plunger very slowly, remove the catheter, remove the speculum, and that's it. The procedure can take anywhere from 5 to 15 minutes for most people. You'll relax in the office with your pelvis tilted for about 15 minutes. The cost of an intrauterine insemination. You'll need to pay for your sperm vial through Fairfax, ovulation predictor kit, which is $20 to $30. IUI procedure depends on your clinic. You'll need to pay the doctors, the labs, the nurse practitioners, whoever you work with. And then there's optional fees that can occur with ultrasounds, medications, and other assessments. We have about a 20% success rate with intrauterine insemination. Again, you can increase your success rate with ultrasounds and medications. Decreasing the rates would be age, over the age of 35, and any comorbidities, especially if they're not controlled, such as diabetes or hypertension. We want to make sure your A1C, your sugar levels are good, and that's important to see the doctor beforehand. So reproductive services, specific reproductive services is the name of our clinic. We are associated with Fairfax Cryobank. The clinic is located in sunny Pasadena, and these are actually, this is a baby that we created. And I'd like to open up to questions and answers. Before we do, it's important that you know that we have a home InSem code for you to save $129 on full unlimited access to the Fairfax Cryobank donors. This will allow for longer clips where you can listen to the donor, longer profiles, and I think Michelle is coming back now.
I'm back. Great job, Kate. Thank you. Yeah, so as Kate said, we have the home insemination promo code that you can use when ordering sperm. If you order through August 31st, it'll save you on that. I'm sorry, not ordering sperm. When you're for full unlimited access, to give you access to the different profile materials that we have online for the donors, it's a savings of $130, and it's a great savings. So now I'd like to invite Morgan to join us to moderate the Q&A session. Kate and I will stay on video to be able to answer your questions. And we're also welcoming Christy, who is our Client Services Assistant Director, to help out with questions as well. Morgan?
Hello, everybody.
Hello.
That's Christy.
Yeah, lots of great questions. So as always, so continue putting your questions into the panel if you have some or if some come to mind as we read through these. The first one here, it says, for home inseminations, is the donor sperm treated in the same way it would be if I was going for IVF?
So again, the sperm, you order the sperm either ICI, which is unwashed, IUI, which is washed, or the ART prep vials, which can be washed or unwashed. If you're doing an at-home insemination and placing the sperm onto the cervix using the needleless syringe, you can use either the ICI or the IUI. It doesn't matter. The ICI hasn't been washed. You're not treating the sperm, you're just thawing the sperm. If someone needs to do an ART procedure or an ICSI procedure in the lab with an embryologist, the IVF is basically when they harvest the eggs and they are going to try fertilization in a dish by introducing the sperm sample to the eggs. Those don't need to be washed or unwashed. It doesn't matter. Again, you can use either one. And for ICSI, same thing. It doesn't matter. For ICSI, they're actually choosing an individual sperm and using a pipette to insert that directly into the egg. So you really only need to purchase one ART vial for that.
Another question here says, when you say the word quality of semen, what does that refer to? How do you measure the quality of the sperm?
Right. So we basically do a fresh evaluation that takes into account all of the initial fresh sperm parameters. So we measure the volume, we do a count to look for the concentration or the total number of sperm. We're measuring motility, so the percentage of sperm that are moving versus those that are not moving. Progression of the sperm, which is how they're moving. Are they just sort of, or are they like zipping along? So we measure that. We do a morphology on our screen donors, which is looking at the shape of the sperm. And then we're looking at a couple of other parameters, the viscosity or the stickiness of the sample, the overall appearance. There's natural debris that occurs in semen samples, such as, broken cells, immature cells, non-sperm cells. They could have skin cells in there or white blood cells. So that is an assessment of the fresh quality, and the World Health Organization has a standard for what a normal healthy semen sample, what those parameters are for that. At the cryobank, our minimum requirements are a little bit higher than that because, as you can imagine, we're putting these sperm through a freeze-thaw process. And as I mentioned, not all of them are going to survive. So when I'm talking about sperm quality, there's the fresh evaluation, and then every sample that we freeze, for sale, we take a tiny volume and put it in what we consider a test vial, and we actually do a post-thaw evaluation on every sample. So we know how that sample is going to look when it's thawed either at your home or at the clinic. And what that's going to tell us is the percentage of cells that survive the freeze thaw process, which will allow us to calculate the total motile cells present. So as I mentioned, we're going to estimate that about 35% to be safe of the cells are going to survive. So we're looking for a 35% motility in that post-thaw vial. And if you back calculate, we basically put in enough fresh, living, swimming sperm so that at the post-thaw, if there's at least a 35% survival, you're going to get a minimum of 10 million total motile cells in that vial, which is generally agreed upon. It's an industry and field standard that 10 million total motile cells is more than sufficient to achieve fertilization through an insemination.
Here's a question that may be more for Kate. It says, when I thawed the sperm for 20 minutes on my counter as directed, when I inserted it, it felt a little cold. Is that normal, or does it mean that it needs more time? Should I be doing something different? This was my first time.
Kate, you're muted.
Sorry, Michelle, did you want to take that?
You can go ahead.
About
I mean, if I'm surprised that you could feel the cold after 20 minutes. That's surprising to me. If you take the sperm and it is on the counter for 15 to 20 minutes and you do that slow inversion, if you see that it's not all thawed, you can leave it for another 5 to 10 minutes. We just don't want to leave it for like an hour at room temperature. Maybe your home is a little cooler. I know I keep mine at 66, so maybe it's not going to thaw as quickly as someone who has a 72 thermometer or a thermostat. You know, so if it's not totally thawed, then you can leave it for 5 to 10 additional minutes. I don't know, Kate, do you have any comment about that?
No, that's what I would have said. And for it to feel cold does make sense. It was recently frozen, but your body will warm it up, and you have the correct temperature, the correct pH. You have cervical mucus. Everything is set up to get pregnant. So you've got that reassurance inside of your body. Okay.
Someone here wants to know, can I use IUI sample for an at-home ICI insemination?
Yes, you absolutely can. Both the ICI and the IUI are going to have, like I said, about 10 million total motile cells. The only difference is that the ICI, as I mentioned, is not a washed sample, so it may be a little bit stickier. So it may, you know, when I say stickier, like the viscosity is there, so it may like stay at the cervix a little bit easier. So if you are doing it with an IUI, maybe stay for the full 2 hours and do switch from your abdomen to your back to sort of allow it to wash over the cervix, as Kate mentioned. Whereas with the ICI, it may have that increased tackiness so that it may stick at the cervix. And that's normal. When sperm is ejaculated, it's a coagulum. It's sticky. We have to actually allow it to liquefy in the lab so that we can do our evaluation. And the purpose for that, naturally, is to allow it to stick up at the cervix, up at the area of the cervix. And it doesn't, you know, as we said, it doesn't enter the cervix. The sperm actually swim through the cervical folds in that environment of the cervical mucus to get through the natural opening so that it can swim on up to the egg. But yes, bottom line, short answer, yes, you can use an IUI sample.
Okay, here's a question that says, can an ICI or IUI vial be used more than once for IVF or ICSI, or each vial a one-time use deal?
So we don't recommend multiple freeze-thaw cycles, because every time you do that, you're introducing more variables. Once you open the vial, you're exposing it to an environment. There's the possibility of contamination. Each time it is frozen and thawed, you know, you are introducing more ice crystals to the samples, and less sperm are going to survive. That being said, I do know there are some clinics that have done that, where they will take a single vial and basically aliquot it into small volumes for use in either IVF or ICSI. I would say one freeze-thaw process is best. You know, if there's limited inventory or limited means so that you can't necessarily purchase an additional vial, I would speak to the staff that you're working with. The doctor may be able to have a conversation with the embryologist or the andrologist in the lab and talk to them about the best way to proceed. You know, if you are anticipating multiple cycles, you may want to consider purchasing the lower cost ART preparation and multiple vials. But if you can't and it's one vial and that's your shot, then I would say just have them freeze multiple aliquots instead of freezing and thawing the same vial multiple times.
Here's a question for Christy. It says, when you sell your vials back to Fairfax, what percentage of the original purchase do you get back?
Great question. So as long as the vials are stored here with us on site and they never leave our facility, you would always have the option to sell them back to us for 50% of what you paid. No time frame on that. It could be, 10 years down the road, totally fine. If that's something you think you want to do, give client services a call. We'll walk you through the process and get you the paperwork that you would need to complete to start that.
We do have a lot of questions here about CMV status. How important is it for CMV? If I'm CMV negative, do I have to use a CMV negative donor? A lot of CMV questions coming in as well. Can you explain that a little bit?
Yeah, I'll comment, and then Kate, I'll pass it over to you as well for what you typically speak to the patients about. I do want to recommend, we have a good write-up on our website about CMV. CMV is the cytomegalovirus, and a large percentage of the population has been exposed to CMV. And when you're exposed to CMV, you may have symptoms, you may not. But regardless, your immune system is going to have a response, and generally you develop antibodies that are going to circulate. And so a CMV positive donor is one that tests total antibody positive, which is an indication of a previous exposure to the CMV virus. Now, when you're talking about CMV antibody, you look for two things. You look for IgG, which is one type of antibody, and IgM. I don't want to get into the nitty-gritty here, but this is the science nerd in me. I like all this stuff. If somebody is IgG positive, what that means is that they've had a previous exposure. If they're IgM positive, it means that they have active virus in their system. Now, we do, above and beyond the required testing, we do a CMV NAT test on semen. And what that means is that we're actually taking a small amount of the semen and we're basically doing what's called an RT-PCR, looking for the viral DNA in the semen. If a donor is CMV positive, it just means that his total antibody is positive. He's had a previous exposure. It does not indicate that there's any risk in contracting CMV through use of that sperm, because if a donor becomes positive and or tests for IgM, which is the active infection, or is CMV NAT, the DNA test in the semen, positive, those samples and any affected samples would be discarded and not sold. So I will tell you, this is something that I will recommend you to speak to your medical professional about. It varies from physician to physician, nurse practitioner to nurse practitioner. I have one physician that we work with that says, I don't care, use whoever you want, it doesn't matter, we know the sperm does not have CMV in it. I have other physicians who are very insistent that if you are CMV negative, you must use a CMV negative donor. So go with your medical professional's recommendation, but please rest assured that the sperm that you're getting from us does not harbor any active CMV virus. Kate, is that sort of along the lines of how you would advise a patient?
Yes. In short, if the donor has active CMV, cytomegalovirus, we pull that sperm from the shelf. You are not able to buy any sperm with active CMV. To what CMV is, it's sort of an obscure disease. It's something we saw a lot in the 80s with patients who had uncontrolled AIDS, and it's not something seen regularly. It's in most people's bodies, and their immune system is able to suppress it. So again, as Michelle said, everyone has a different idea about it. I'm buy whichever one. You're not at risk. That's my thought on it.
Kate, someone wants to know if you have a recommendation for ovulation kit that you like.
Yes. So I wouldn't recommend one particular brand, but I will tell you I like the ones I just think of them as litmus paper. It has this little sponge on the end to collect your urine, and then there's 2 lines here. I would not buy the digital. I don't like the digital. I think that that's more for fresh sperm usage, such as heterosexual sex. And when we're doing inseminations, like I said, we want to get that ovulation date perfect. We don't want to know that you're fertile for 5 days because the sperm can live for 5 days. We want to know the exact timing, and the one with the 2 lines will tell you as exact as possible. Okay.
Okay. Christy, we have a couple questions about shipment. How fast does the sperm ship, and then when should it be ordered? And then another question about local pickup as well, what they need to do to go through that process.
Sure. So shipping times will vary depending on where you're located or where your clinic's located. We ship through FedEx. On average, it's going to be 1 to 2 business days. FedEx won't deliver on the weekend, so it's really like a Monday through Friday delivery. We do offer pickup at almost all of our locations, and we do have labs throughout the country. I would recommend that you reach out to our CS team, because depending on what laboratory you pick up from, it'll be a little bit of a different process. But no matter where you want to pick up from, I highly recommend that you call minimum, I would say 3 business days in advance at a minimum, so we can walk you through that particular process. I always say it's good to be calling earlier than waiting till the last second. So as soon as you know, call us, and we're happy to help you, narrow that down depending on what your situation is.
And just to note for all of our attendees, we're located we have 6 locations where you can do pickups. We're in Fairfax, Virginia, where it's sort of our home base. But you can also pick up from any of our locations, the Philadelphia and Pennsylvania. We've got 2 locations in Texas. We're in Austin and in Houston. We're in Roseville, Minnesota. And then, of course, we have the Pasadena location in California.
All right, here's a question that says, what is the recommendation on how to purchase the number of vials, to determine the number of vials to purchase?
Christy, you want to take it?
Sure, yeah, definitely. It will depend. So, I mean, there's a kind of, you can get an idea that it's usually going to be, on average, between 1 to 2 vials per procedure. If you're doing it at home, I usually see clients start out with 1. If you're going to ship to your doctor's office, definitely discuss with them before you place the order, because I've seen some doctors say 1, some say 4. Really kind of depends. But on average, I would say 1 to 2 vials, you're safe. You're doing good.
That's per insemination.
Yes, thank you, Michelle. Per insemination, yes.
Kate, we're getting a couple questions about your recommendations on the best way to stay elevated and how to stay tilted properly. Any tips or anything?
Yeah, I would recommend just using a decorative pillow and putting it under your buttocks. You want your pelvis to be tilted upwards. Doesn't matter if it's too tilted or a little bit tilted, the sperm will go in the direction that it needs to go. It just needs to fall at the end of the vaginal canal and then wash over the cervix. So really, whatever you have that is comfortable, because you're going to be there for 2 hours, especially if you're doing ICI, just find something that's comfortable for you. If you feel like you need to go to your side for a little bit, that's fine too. Just keep your pelvis tilted upward. You want gravity to work with you.
At one of the family building events that I've done, someone told me that they found the perfect yoga bolster, and we're using that.
Okay, yeah, there are the triangle pillows that are shaped like a triangle. You could use something like that. That might actually be more comfortable.
Someone wants to know, what is the relative cost of ICI versus IUI versus IVF/ICSI?
There's a huge variability in those costs. If you're doing an at-home insemination, as Kate outlined, it's basically the cost of the sperm and whatever, and however you want to set up your environment, but it's the sperm cost. If you're doing an in-office IUI, it's clinic dependent. There are some clinics and physicians where they do accept insurance. It depends on your insurance coverage. But I would say it's several $100s out of pocket for an in-office IUI. Is that accurate, Kate?
Yeah, so if you're considering the purchase of the sperm as well as the procedure, and you'd be paying for the lab to prep your sperm, you'd be paying for the actual catheter, the tools we use, as well as the provider to inseminate. That can be several $100s, depending on who does it for you. It can be anywhere from $500 to $1,000, plus the vial of sperm, which will be roughly $1,000. So you're looking at anywhere from $1,500 to $2,000. That's just a ballpark figure for each cycle for intrauterine insemination. But that's, you're paying for an increase rates, success rates.
That's right. Yeah. And then talking about IVF and ICSI, that is going to be highly variable by clinic. Generally, it's anywhere, the ballpark that I see the most is anywhere from $8,000 to $15,000, because when you're doing IVF, it's the process of, you know, the medication, the egg retrieval, the actual process of the IVF. Then you have to consider the embryo transfer. There's just a lot more involved. And then of course, ICSI is incredibly specialized. You know, there are far fewer staff that are trained to do ICSI than there are to do inseminations. And so that of course is a bit of a premium. But really going through any of that, again, to do ICSI, you have to go through all of the same IVF processes to harvest the eggs and everything. So there's medication costs, there's the cost of the ultrasounds, the cost of the egg retrieval, the cost of the actual procedure. And then you also have to consider storage costs as well for the embryos and or the oocytes that are that result, and then add in the sperm cost. So IVF, like I said, anywhere from $8,000 to $15,000. If you're doing ICSI, it could go upwards of $20,000. I would say would be the range.
For home inseminations, would you recommend 2 ICI or 4 ICI ART? What is the difference?
I would actually recommend 1 ICI vial for 1 insemination. If you're going to do multiple inseminations per cycle, then do 2 vials. I would basically say 1 ICI or 2 ICI ART per insemination.
Is the ART price listed for 1 vial or for 2?
1.
Okay. Someone here has a question that says, as for determining LH surge via blood work, is there a certain level or number that physicians are looking for?
Yeah, so you're talking about getting your LH surge measured in the lab by your provider. That would be up to the lab and the provider. We deal exclusively with ovulation predictor kits, and they'll let you know when you have your LH surge. So your LH is, if you look at a map of your LH surge, your LH is very, very low in your body, and then it spikes up 10-fold, 20-fold in numbers. So if you normally have a very low number, which most people do, it will spike up 10, 20 times that. Does that answer your question?
Not my question, but I think, yeah, hopefully that person, if that person wants to follow up with us, we'll let you know.
Yeah, ask your provider.
Someone wants to know how long sperm lives in the body after an IUI.
Yeah, so our frozen sperm will live up to 24 hours in the body. As I said earlier, you have the right pH, you have the right cervical mucus, that everything is set up for that sperm to live inside your body. Fresh sperm, as we know, can live 3 to 5 days inside the body, but frozen is up to 24 hours.
And if you think about it, that's because that frozen sperm's been through a lot. You know, it's been processed, it's been frozen with a helpful freeze media, and then it's gone through that thaw process. You know, we say up to 24 hours. It could be a little bit more, it could be a little bit less, but it's been through a lot. So it doesn't have as long of a survivability as fresh sperm does.
So can you purchase the IUI home kit?
So we don't actually have, oh, that's a good question. Kate, can we do an IUI at home?
We cannot do an IUI at home. It is only for a medical professional, and I would recommend not even trying it. Even if you can get a hold of those tools, you're at risk of uterine perforation, uterine infection. There's small risks, but they are there, and I would not recommend doing it at home. You want to do it in a doctor's office, lying on an exam table, someone who's wearing clean gloves and knows how to do the procedure. So you can purchase our vial for ICI, and it will come with the tools that you need, the syringe, in order to do insertion. Okay, so I would not recommend doing an IUI at home.
Can the sex of the baby be estimated by the timing of the insemination, whether in home or in the clinic?
Kate, that's all you.
Yeah, the answer is no. Just no. Sorry.
Here's
Yeah,
one for
people
Christy.
think that X sperm, like sperm carrying the X chromosome, like way more, so they swim slower. It's not true. I mean, minuscule, like unmeasurable difference in weight. So,
but don't worry, everyone asks that question. Everyone.
Yeah. It's definitely one of those dispel the myths question.
It's a good question.
Yeah.
Christy, for you, just to confirm, at-home insemination, you just need a form signed and then they're good to go, correct? That's what...
Correct. There is a form that needs to be completed. Depending on your area, could be a little bit different. But if home insemination is something you're looking to do, just reach out to our CS team by phone. We'll get some basic information from you, and then we'll walk you through the process of what form will need to be completed so we can get that to your house.
And Christy, while you're here with us, a couple questions about fees around sperm storage, or excuse me, any sort of storage, specimen storage. Where can they find more information about that?
Sure. So we have a fee list on our website. Right now, for everybody to know, we are offering 3 months of free storage with any sperm order. So even one vial can get you 3 months for free. Beyond that, when we don't have something special running, it's on average about $40 per month. It's a flat fee, no matter how many vials you're storing here with us. And then for our clients who would like to store longer term, we have some prepaid options where you end up saving some money if you decide to keep the sperm stored that full amount of time. For those, I have anywhere from 6 months up to 10 years. So we have a lot of different options. But if you're thinking about storing, now's the time because we do have that 3 months for free.
So I guess someone says if success rate of ICI is 10% and success rate of IUI is 20%, what about IVF?
Yeah, IVF's different because in that instance, fertilization is happening. There, as we said, IVF, you're harvesting the eggs, and those are being introduced. The sperm's being introduced in the lab environment in a dish, and so they're creating the embryos prior to they have to create the embryos, and then they monitor them for several days, and then they choose the normal embryos that are developing properly to do a transfer. So the success rate is different. Your success rate in terms of fertilization, depends on the health of the egg, depends on the environment, all of that. And then, so you're talking about a success rate of fertilization, and then you're talking about the success rate of the actual embryo transfer. And there are so many variables involved in that. Your medical professional would have to advise you about your statistical chances at the embryo transfer.
If an IUI didn't work, will that mean that an ICI will definitely not work?
I think it depends on the reason why it didn't work. We know that for IUIs, it takes anywhere from 3 to 6 cycles on average to see success. That doesn't mean that we don't have success on the first try. If an IUI is 20% chance of success, we actually know that heterosexual sex is 20% chance of getting pregnant. So that's an 80% chance of not getting pregnant, unfortunately. So we usually have to do it multiple times. If an IUI doesn't work, it's important to determine why the IUI is not working. Usually your medical provider will do an assessment beforehand to understand what you're working with. Is there low fertility? Is there polycystic ovarian syndrome? What exactly is going on that could be causing the IUI not to work? And you also have to think that there's just luck. There's just the cosmos involved in whether or not that sperm is going to get to that egg. And that's why we recommend 3 to 6 chances, 3 to 6 tries.
Can you let us know what range you look for good AMH levels?
Yes, I can. So it's important to say that I am licensed in California, and I cannot give medical advice, but I will tell you there's some standards for AMH. So AMH is anti-Müllerian hormone. Most people do not know what AMH is. So when you're born with all the eggs you're ever going to have, and they hang out in your ovaries. Those eggs will secrete a hormone called anti-Müllerian hormone. If you have a lot of eggs, you have a very high number. If you have very few eggs, you have a low number. Over the age of, say, 38, 39, your AMH starts to decrease. After the age of 40, 41, it can decrease exponentially, meaning it can halve within a year's time. We recommend that you get AMH done every year. Anything below a 1.0, I would recommend talking to a reproductive endocrinologist. Over a 1 is fine with me for IUI. We always talk to our patients about what that means, and that maybe in a year's time we'll need to revisit and possibly refer to reproductive endocrinology. So you do have decreased rates if you're about a 1.0, but it's still feasible to do an IUI. If you have something like a 1, I would recommend not doing an ICI. I would recommend doing an IUI. I think it's just more bang for your buck. It makes more sense.
When do you see LH surge? When you see the LH surge, when do you inseminate?
Great question. So your LH surge happens 24 hours before you ovulate. Once you ovulate, you're fertile for about 24 hours. So you'll get your positive OPK, or ovulation predictor kit. In 24 hours, you can inseminate. Okay. The OPK kits, they like to show pictures like we had on the slides, where it says that you're fertile for 2 days, you're fertile for 5 days. You're really only fertile when you're ovulating. Only fertile when you're ovulating.
Someone wants to know, how long does it normally take for new vials to be released for purchasing?
So our donors are basically collecting samples over time, and we're doing blood draws to clear those samples from quarantine. The FDA requires that we store every vial in quarantine for a minimum of 180 days, and each vial has to have both a pre and a post acceptable test in order for us to release it. We try to do releases at least every 90 days, so every 3 months or so we try to do those blood draws to release inventory or vials to you all. Sometimes we will do an additional blood draw, like an optional draw, just to clear some additional inventory if the donor will sell out. As you can imagine, with the COVID pandemic, things have been a little challenging, you know, in terms of getting people in for blood draws, in terms of having people available to do the blood draws. So there may have been some delays. I will tell you, I just cleared a bunch of inventory today. But you know, it's ongoing, and it's not something that we can never guarantee that additional inventory will be released, because like we said, it depends on those acceptable tests after 6 months after the vial date. And there's really, the best I can say is a minimum of every 3 months, potentially with additional months in there to release some additional inventory.
Would you recommend one ICI INSEM when you get your darkest OPK at home, and then another ICI INSEM 24 to 36 hours later for non-hetero couples?
I would recommend that you do one ICI 24 hours after getting your positive OPK. The science tells us that you're not fertile the day before you ovulate, and that sperm's only going to live for about 24 hours. The studies are plentiful. There's many, many, many studies about whether or not you should do 1 vial or 2 vials, 1 insemination or 2 insemination per cycle, and it's divided. It's 50-50. There are some studies that say it's helpful and some say that it's not helpful at all. So the science is not there yet. I'm not quite sure why, but what we do know is that you're only fertile the day after you get your LH surge.
Do you always distribute the donor's sperm vials in the order they are labeled? For instance, if I receive the donor's IUI vial number 2, does that mean that the donor has only had 1 IUI vial used before me?
No, so so what you're going to see on the vial label is you're going to see the donor number, and then it'll have, vial 1, 2, 3, 4, 5. That just means that that's the number of vials in that from that one ejaculate. And we can get anywhere from 1 to 7 vials per ejaculate. It depends on what the count of the sperm and the motility of the sperm is. Average, I would say, of 3 vials per ejaculate. That's only for that one specimen date. So if you have vial number 2 from, January 2nd, 2020, well, you wouldn't have that. Yes, you could have that one. I was thinking, is it 6 months ago? So if you January 2nd for 2020, vial number 2, that means that's the second vial that was created from one ejaculate.
For an in-office IUI, is your partner able to plunge the sperm into the other partner?
That's a great question. I get that question a lot. Depends on the provider. So a lot of providers will insert the catheter. Let me do it right. This is your speculum. Catheter goes in, and we know the sperm is at the very end of this. Some providers will let the partner actually push that vial. Once it's in, it's pretty safe. So yeah, I think it's worth asking, definitely.
Another question here says, I'm afraid of using a soft cup. I feel like if I push it in, it might trap the sperm in the wrong direction. Is that possible?
Not necessarily. So, Michelle, am I able to go through the slides to find a picture?
You should be, yeah.
Okay. Let's see if we can.
If you haven't used a soft cup before, I would just start by recommending that you try using one. It's basically the same thing as a menstrual cup, or like I know Flex is one brand that uses, it's like a silicone ring with the plastic here. I would just get it and use it and put it in and practice with it before you try to do it with the insemination generally.
Yeah, that's a really good point. So it will gravitate towards the cervix. It will actually, can you see my cursor?
Yes.
Okay, so you'll insert it sideways, it will manage to gravitate towards the cervix and get cupped onto there. The cervix protrudes out a little bit, and the ring, the plastic part of the ring, the harder plastic part, will actually surround it perfectly. You just gotta trust me on this one, I think. But yeah, it's pretty easy to get in, and I would not worry about that. I would not recommend putting it in the cup first and then inserting it. I don't think that that's a good idea. I would insert it, lay around for 2 hours, and then maybe put your cup in. You can also put your cup in immediately. It's up to you.
They're really easy to use. Like once you do it once, it's super easy. And like Kate said, it really does take on the shape of your vaginal canal, and it sort of really does just cap the cervix.
Here's another question. I have heard that having an orgasm before insemination helps. Is this true?
Yes. So orgasm is helpful. I would recommend doing it after the insemination, since that sperm is going to live 24 hours. If you have an ICI, you can do it in your own home. If you're doing an IUI, you can wait until you get home to do that. And you can do it more than once if you want. So it's going to cramp those muscles and encourage the sperm to go into the fallopian tubes where that egg, that mature egg, is waiting for it. So I would recommend doing that after an ICI or an IUI. It's a great question.
Another one here for you. It says the instructions in the OPKs say that if you have PCOS, the results are likely to be wrong because we likely have higher baseline LH levels. Any other ways to get accurate results at home?
Yeah, no, that's true. So if you have PCOS or polycystic ovarian syndrome, there can be errors in the OPKs. There are blood draws to check hormones, not at home, unfortunately. I really wish that our OPKs were geared towards women with PCOS and geared towards couples that were same sex. It'd be a lot easier. But no, there is no way for finding out in home. If you go to your doctor's office, they can use ultrasounds to watch that follicle grow. You may need anywhere from 1 to 4 ultrasounds in a cycle. It depends on how fast you grow. If you're going to do 3 to 6 cycles total, and you're going to do 1 to 4 ultrasounds per cycle, please know that your doctor will start to understand your body better and will be able to time those ultrasounds more appropriately. So you'll probably end up doing less than 4 as you get to your 3rd, 4th, 5th, 6th cycle, if that made sense.
Can you repeat again what type of sperm to purchase if we are doing an in-home procedure?
Sure. So for an in-home insemination, you can purchase 1 ICI vial, you can purchase 2 ICI ART vials, or you can purchase 1 IUI vial.
And what's the difference between washed and unwashed?
So it's just washing means that we're removing the seminal fluid from the sample and basically concentrating the sperm cells and then resuspending them in a media and a freeze media that protects the sperm. Whereas the unwashed or standard sample, we leave the seminal fluid in there and we add the freeze media with a cryoprotectant to help the sperm survivability. And the reason we provide those 2 options is that if you're having an IUI in the office with the doctor, or medical provider, you have to have a washed sample. Now you can use an ICI vial if that's all that's available, as long as your clinic washes it and washes that seminal fluid out. And again, that's because the seminal fluid contains hormones and proteins that can cause cramping in the uterus.
We're getting a couple questions about the Mosey kit. Is it any better than the needleless syringe provided?
I'm not familiar with the Mosey kit. I don't know what that is.
I think it's a home insemination kit.
I can look it up.
Yeah, I'm sorry.
I mean, there's no reason to use anything other than a needleless syringe. I know there are some things that are more like a, can I say sex toy? More like a sex toy, like almost like a vibrator or a dildo that has a catheter in it. You can use that if that is something that you're more comfortable with, but you don't need to use anything more than just the needleless syringe. It really is a personal choice and personal preference.
Yeah, can I piggyback on that? I get asked a lot if patients should use lubricant or pre-seed to help the sperm flow. I would recommend that you just stick with your cervical mucus. It is fantastic. It has these channels in it that help the sperm swim into the uterus. Lubricant does not. I would think that the lubricant like pre-seed is not going to kill the sperm, but it's not going to necessarily help the sperm get up there, and certainly not in the way that the cervical mucus will do for you.
So here's a series of questions for you, Michelle. It says, how in depth are the donors tested? And another person wants to know how we select and screen our donors.
Sure. So first, let me just say, if you look back on our blog, we did a donor screening webinar last month maybe, but I went through all the details of how we screen them, all of the testing and everything. But just as a quick way to answer the question, we recruit our donors through social media, print ads, online advertising. They have to complete an application online. They answer their social and lifestyle questions, which inform us about their health. They answer 3 to 4 generations of medical history, so themselves, their parents, their grandparents, and if they themselves have children, they provide us with a medical history for all of their family members. That's reviewed against a guideline that our medical director has created to look for medical suitability. So basically, if there's somebody with clustering of any heritable diseases, they would be ruled out. Once we look at the medical application, if that appears to be suitable, they come in to do multiple screening samples where we look at sperm samples, to do that fresh evaluation that I talked about, and also to do that freeze thaw to look for 1, consistency in their ability to provide us with good, healthy samples, and 2, to ensure that the cells have a high survivability rate. We don't keep any of those screen samples because, as you may have noticed, I didn't mention any infectious disease testing yet. So we toss all of those screen samples. If at that point we would have the donor do a physical exam with a medical provider, all of the infectious disease tests that are required by the FDA. And then I mentioned we do above and beyond those tests, we add some nucleic acid or DNA testing for various sexually transmitted diseases. You can see a full list of the testing that we do online. We also do expanded carrier screening, which is a genetic screening for recessive disorders. That looks at over 280 diseases. We do a karyotype, which is a chromosome analysis, and then a hemoglobinopathy, which is looking at thalassemias and sickle cell, for example. We also, in addition to the medical testing, we do a background check, a criminal background check, and we do a psych evaluation, which is the PAI, the Personality Assessment Index. It's a test that's used by mental health providers to identify psychopathologies, and if there is a psychopathology indicated, that donor would also not be accepted into the program. We verify their transcripts by getting copies or their diploma. So there's a lot that goes into the screening process. And as I mentioned earlier, they're having infectious disease testing periodically every 3 to 6 months at a minminum.
As well as physical
go back
exam.
and check out that previous webinar.
Mm-hmm. And does the donor's blood type matter?
Kate?
Yes. So this is a tricky question. It's a good question. So the concern is for the positive or negative, or the RH factor. If a woman is RH negative and the donor is RH positive, if she has any sort of accident that causes bleeding during pregnancy, she'll need to get a RhoGAM injection, which will allow her to not create antibodies against the fetus or future pregnancies. It's important to say that you can use any donor with any blood type, but it's important to know that if you should have any bleeding during your pregnancy and you have a donor who is positive and you're negative, that you should seek medical care.
So it looks like we have a ton more questions. You're all asking fantastic questions. Thank you for submitting them. So as long as Kate's available, we'll keep going for another 10 minutes or so. Does that work for you, Kate? Okay, so we'll keep going for about another 10 minutes, and then anything after that we'll try to do a blog post for. So go ahead, Morgan. What's next?
So many. Sorry, guys. I feel like I'm trying to pick the best ones here,
No, it's
or
great.
common themes
These
that
are
we're seeing.
Great questions.
Someone wants to know, can having an orgasm before ICI help at all with getting pregnant at home? I assume not, but worth asking.
Yeah, the question was about having an orgasm before an ICI.
Yes,
I would recommend having it after, but yeah, I think it helps a lot. We had that question previously. It causes cramping in the uterus that allows the sperm to swim into the fallopian tubes. It can increase your chances. So yeah, I would recommend having an orgasm after an ICI. I would recommend even having one after an IUI.
Okay, another question, why not put it in the cup to then insert the sperm?
So I guess I'll just go. Sorry, Kate, I jumped in this one. If you're using the needleless syringe, you can get as close to the cervix as possible and slowly expel it, and you're putting it right there on the cervix, and you're actually placing the semen sample onto the cervix, which allows that sperm to wash over and swim through the cervical folds to get through the cervical opening. If you're putting it in the soft cup and then placing the cup on, if you don't get a seal, if your cup is not exactly there, then you're adding another variable where the sperm has to try to swim out of the cup onto you. So that's what my understanding of it would be. Do you agree, Kate?
I agree, yes.
How long after ICI should one wait to have intercourse after ICI or IUI?
Yeah, so after ICI or IUI, and I'm assuming you're asking about penetrative sex, I would recommend about 24 hours. That sperm's gonna live for 24 hours, you're fertile for 24 hours, so I would wait that length of time.
Michelle, here's a question. We're getting a question here. Are we getting less donors because of COVID?
No. So basically at this point, the FDA hasn't required a specific test because right now there's just diagnostic testing that's been FDA certified for COVID. The antibody test to show previous exposure hasn't been certified at this time. We are screening, and if a donor has had a known or suspected exposure to COVID, we're not allowing him to come in for at least 28 days. It's usually a little bit longer. And if a donor has had COVID, we're putting him on a deferral as well. But it hasn't affected our number of applicants or the number of guys that we're screening at this point. And really, at this point, it's important to note, just for general knowledge about COVID, this is a very new virus. We're still learning so much. There's not a ton of research out there, and everything that's being published, we're reading and keeping up with. We don't know how long it survives in the body. We don't know definitively if it is transmissible through, an insemination or even, or sexually transmissible. There was just a documented case in the last month of a umbilical transmission from a mother to a fetus. But other than that, we're all still learning. So we're erring on the side of cautious. And if somebody is known to be exposed or possibly exposed, we're deferring them until we know that they're healthy.
So switching gears a bit for Christy, we have someone on the call from South Africa who has some questions about if we know if ICI is permissible in South Africa and if they can get a home insemination kit delivered there. I guess Christy, if you could speak a little bit to our global client services team and how these people can get in touch with that group.
Definitely. So the global team is me. So you'll be speaking with me over email. I encourage all of our international clients to email with any questions that they have. It's global@fairfaxcryobank.com. In general, we do ship to South Africa, so that we can do. In regards to shipping to a home, it's a little bit more difficult internationally. I haven't had any experience with shipping to a home there, but it doesn't mean it couldn't be done. We would have to research it, definitely. And I would recommend that particular client reach out at the global email, and we can do our best to assist.
Kate, here's a question for you. How does ICI or IUI work well for individuals with irregular periods? What insemination method would be recommended if not either of these?
Yes, for irregular periods, there's a couple of things you can do. So if you want to see your gynecologist and determine why you have irregular periods, that would be very helpful to start with. You can also take birth control for up to 3 months, maybe even a little longer, depends on how irregular your cycles are. If you're having missed months where you're going a whole month without a period or a whole 3-month period without an actual menstruation, I would highly recommend seeing your gynecologist and determining why that's happening. Once you determine the cause, then you can approach accordingly. With that being said, having super irregular periods, and by super irregular, I mean not 1 or 2 days in length difference, but 5 days, 6 days, 7 days, whole month. What was I saying? It's important to determine the cause. And then, if you're having super irregular periods, just a guess, I would say IUI is probably better for you. You most likely will need something like an ultrasound to determine that you are developing follicles, and then we give an injection that can help you ovulate. Sometimes when there's irregular cycles or missed months at a time, it's because the patient is not ovulating. And we can encourage that with a medication that has very minimal side effects. It's pretty great. It's called Ovidrel.
For same-sex couples, should they also wait 24 hours after IUI or ICI to have an orgasm?
For same-sex couples, you do not need to wait 24 hours to have an orgasm. In fact, orgasms can encourage the movement of the sperm into the fallopian tubes. If same-sex couples are planning on having penetrative sex, I would wait 24 hours. So wait 24 hours for penetrative sex. Orgasm is fine immediately. In fact, it's recommended in that first 24 hours.
Christy, we've got some questions about donor availability, trying to figure out if a donor's on the wait list or their wait list is full, how they can get more information on the donor eventually coming back and having availability.
Great question. It's totally donor dependent though, so I can't give a blanket answer for that, unfortunately. I would recommend that the client reach out to our CS team with the donor number, and from there we can let you know if the list is full or not. We can let you know if the donor is still active in the program and if the donor has more vials pending. And with that information, at least you can get a better idea if you might want to wait for the donor, or maybe it would be better to have a second choice in mind. So definitely reach out to our CS team. You can reach out to us by phone or by email. We can do that for you and give you a little bit more information with a specific donor number.
There's also a great feature on our donor search now. When you go to your donor's profile page, there are similar donors that will come up at the very bottom. If you scroll all the way down, it'll show you other donors that share characteristics. So it might be good to use that feature to have a backup if your donor doesn't have availability at this time.
If I purchase 2 vials, what is the timing for insemination after ovulation?
So you're asking about the timing of doing 2 separate vials. You don't want to do an insemination with 2 vials. The uterus can actually only hold so much, and 1 vial is plenty. I would say that there are lots of studies talking about doing 2 different inseminations in a cycle and when to do them and whether or not they're effective. The thought is 12 and 24, or 24 and 36 hours. The science tells us you're only fertile 24 hours after your LH surge, and then you're fertile for that 24 hours. So if you do it at 12, the science tells us you're not actually fertile. If you do it at 36, the science tells us that you're not fertile. So I would recommend inseminating 24 hours after your LH positive or after your positive OPK test.
Is there any way to test donors for genetic diseases?
We do. We do the expanded carrier screen, as I mentioned, for recessive disorders. If you have a specific condition, if you yourself are a carrier, you can actually, on our donor search, search for donors who are negative for specific disorders. If you go down to the advanced search option, you can either do it by the gene name or by the disease name. If you know that you're a carrier for a condition that doesn't happen to be on the panel that that donor has had, because obviously the donors are screened at different times and we're doing the screening that's available now, whereas a donor that was screened 3 years ago would have had different diseases potentially screened for. So if you do have something that you're not able to find on the catalog, you can contact customer services. They'll put you in touch with our genetic counselor, and there is a special testing process that you can go through in order to find a donor that meets your needs. Okay, I think so we're at 3:30. Thanks to all of you who've been with us for an hour and a half. This is great. I know there are more questions, and I'm sorry that we can't get to all of them today, but Kate and I will go through the questions that have been submitted, and our team will put together a blog post and put that up as soon as possible. I do want to mention that there is going to be another webinar next month. We're having such great success with these webinars, and you all have been so wonderful about looking forward to them and registering for them. So next month, Suzanne Seitz, our genetic counselor, is going to present a new topic. It's being a part of the Fairfax family, what you need to know once your baby's born. And she's going to be talking about ID donors and the process to connect offspring with the donor, about birth reporting and the importance of that, and then talk about our donor annual updates, which I'm very proud of. and some chat about our donor forums, specifically about the private donor groups that we offer on the Fairfax Family Forums. So please look out for notification of that webinar and register. And we hope that this was helpful for all of you. And once again, Kate, thank you. Morgan, Christy, thank you both. This was really great. And thank you all for being with us and for submitting your fantastic questions.